Hi, I'm Dr. Jason Wang. I'm one of the ophthalmologists at Omni Eye Specialists. My particular area of expertise is with corneal and anterior segment disease, where I treat problems with the cornea, also cataract surgical needs, and laser refractive needs as well. The reason you can trust Omni Eye Specialists is that we have been doing cataract surgery for a long period of time. Our practice was started in the mid-1980s, and we've been providing medical and surgical services for cataract surgery and the various elements of it with our referring community for that duration of time. I've personally been doing cataract surgery here since I joined in 2002, so it's over 20 years, and feel that we have the dedication to the craft to help provide patients a great visual outcome. Cataracts are typically just an age-related change to the natural lens. It's hard to avoid developing cataracts. Some patients will develop it earlier in life and others later in life, but commonly patients will approach cataract surgery ages in their 60s and 70s. There are some genetic and post-surgical or post-traumatic causes that lead to cataract surgery at an earlier age, but those are less common. The routine cataract surgery patient comes in with age-related changes to the lens that are hard to avoid no matter what patients do. I don't like to think of cataracts as being a disease process, but more of a natural part of getting older. Thankfully, we have treatments for cataracts that are effective and can help restore normal, youthful vision. Symptoms that cataracts cause most commonly start off at the earlier stages with night vision symptoms. Patients often will report to me that they feel that it's harder to drive at nighttime. There's some increased glare off of headlights, oncoming headlights in particular. Patients will find that their night vision isn't as sharp as they recall it being, perhaps having harder difficulty making out street signs when they're doing their driving. As cataracts progress, their symptoms are not just at nighttime, but oftentimes during the daytime as well, making those activities that others take for granted more difficult. Cataracts are diagnosed with an exam with an eye care provider. We have instrumentation at the office where we have an enlarged view with a microscope with lighting that can spotlight areas of the lens that are clear or are cloudy. We can detect progression over time by monitoring with the instrumentation that we have. There's also some higher level technologies that can monitor and document for progression over time if that's needed. The question of when a person needs cataract surgery doesn't have a simple answer. It's an individualized answer that varies depending on the person. Some patients come in with a certain amount of cataract, and if that doesn't impact that person's individual particular needs, we'll oftentimes encourage leaving it alone. That same amount of cataract on someone who does a lot of night driving or sewing or golfing or other activities that require real sharpness of clarity, will oftentimes encourage going forward at an earlier stage of cataract.